Hi, my name is Dr. Leigh Neumayer, and I am a surgeon. I'm also a professor of surgery and chair of the Department of Surgery here at UF Health Jacksonville. So as we've talked about, the majority of breast cancer these days are diagnosed through mammogram, and they might be 1 centimeter in size. So that's basically, if I cut my pinky off right there, that's how big that would be. And so depending on the size of your breast, for most women, they have a reasonably good sized breast. So to remove an entire breast to take care of a cancer that's this big, when we know from randomized trials, the outcome, the long-term survival, is not dependent on what you do to your breast, it's dependent on the biology of the cancer and your systemic treatment. It just doesn't make sense. So in many cases, we can treat breast cancer with a surgery called a lumpectomy, and that's an outpatient surgery. You come in and go home the same day. We don't restrict your activities in any way, shape, or form. You can go back to normal things within a day or two, and that's a very easy surgery to get through. A mastectomy means we're going to remove all of the breast tissue, and that surgery will require, usually, you sometimes can go home if you don't have reconstruction that day. I usually like to keep patients in the hospital overnight just to make sure everything's good to go, and they go home the next day. No heavy lifting for 4 to 6 weeks. You can have reconstruction with that, which I strongly recommend. In my practice, everyone's a candidate for reconstruction unless there's a medical reason they can't. If you're a smoker, we don't like to do it because of the risk of complications if you're a smoker. But I send everybody to the plastic surgeon, except I do have a couple of limits. Number one, if you're over age 85, you don't have to go see the plastic surgeon. If you say you don't want reconstruction, I'm okay with that. Otherwise, I send you off to see them because I think you want to be able to make an informed decision about this. Now, a question you should probably ask me is, what if my surgeon is recommending mastectomy and the surgeon has time on their schedule next Tuesday, and I ask about reconstruction, they say, oh, you can do that later, what should I do? So that's a really good question. What you should do in that circumstance is try to slow things down. Remember, the doubling time of breast cancer is not such that you need to be in the operating room next Tuesday, and you should insist on seeing a plastic surgeon.